This week on tech-byte, we are celebrating National Heart Month, which is February, by showing you what this piece of nickel titanium alloy will do to save your life. I'm Patrick Moats. Welcome to this week's tech-byte.
Tech-byte, sponsored by Epico's Comics, Cards, and Games.
This week on tech-byte, here we are in the operating room at the Vascular Institute of Chattanooga with our guest, Dr. William Harris. Thank you so much for joining us. February is National Heart Month. And so I know that you and Dr. Lassar joke that you're both plumbers. You fix the pipes. Tell me why we're here and what you're going to show us today, what tech is involved.
Well, today, Patrick, we're going to talk about carotid artery disease, which is something very near and dear to my heart and everybody else's heart. And carotid blockages affect a tremendous amount of the population in Southeast Tennessee because of people are obese, there are a lot of cigarette smokers, and other genetic factors.
Okay. So what technology are you using to treat this? How is it different than it was, the good old days?
So carotid artery disease actually can cause strokes. It's one of the leading causes of strokes in the United States. Classically, when we see a carotid artery blockage, make a big incision on the neck that looks like you got into a knife fight and clean out that artery, scrape out the artery, and then sew on a little patch. Nowadays, we can access the carotid through a tiny little incision at the base of the neck and slide a stent in. Number one, it's cosmetically more appealing, and it's less morbid, so there are less nerve injury. There's a very, very low risk of stroke with the procedure, and it's overall a great new procedure that we bring to the table.
Okay, so you've abbreviated it TCAR a couple times. What does that stand for?
Transcarotid artery revascularization, TCAR.
TCAR, that's very interesting. I'm assuming not everyone is a candidate for this kind of, how do I know if I'm a candidate? Let's start
That's
there.
right. First thing is we screen for carotid artery disease. If you've had a stroke or if you've got the risk factors for carotid artery disease, which are some of the same risk factors for coronary artery disease or heart disease, we do a simple ultrasound which can evaluate whether or not the patient has significant carotid blockage. Then sometimes we'll get a CT scan to further evaluate the carotids to see if you're a candidate for TCAR versus the traditional open surgery. We still do the traditional open surgery, and sometimes we do stents delivered from other means as well, but this is a great new option.
And so the technology, like you mentioned, ultrasound, you mentioned, so all of that goes into one, determining if you're a candidate,
It does.
and two, the treatment.
Correct. So we put everything together. We put the patient's health together, if they've had previous operations. We look at the CT scan, we look at the ultrasound to determine whether or not the patient would be a candidate for TCAR. Certain patients have anatomical issues that may make them a better candidate for a TCAR versus the traditional surgery, or they may have characteristics of the blockages that may make them a better candidate for an open surgery versus the new TCAR.
Okay.
Yeah, it's pretty neat.
It is pretty neat. So the technology is fascinating. Thank you for taking a minute to share it with us. Guys, if you think you've had a stroke, you have history of strokes, carotid artery disease, look up our friend Dr. Harris here at the Vascular Institute of Chattanooga.com. They have 6 locations to serve you better. Dr. Harris, thank you for joining us this week. I'm Patrick Moats. Thank you all for watching tech-byte.
Tech-byte, sponsored by Epico's Comics, Cards, and Games.